Welcome, viewers and listeners, to the COVID-19 update for today, January 9, 2022. Of course, we will be speaking with the Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you for joining us this morning.
Thank you very much for having me on the program.
Minister, let's begin COVID-19 update with our current active cases and hospitalization numbers.
So over the last 24 hours, we had 184 new cases. And overall active cases, we have currently 4,358 cases. And this is in all regions of Guyana. In terms of hospitalization, we currently have 91 persons in hospital, with 68 of those persons at the Ocean View Hospital. And of the 68 persons, we have 17 of them who are in the ICU.
Okay, Minister, secondly, can you say how many tests are conducted daily since the implementation of the new testing guidelines?
So right now, on average, we're doing 2,219 tests per day. So if we go back and look at testing generally, in 2020 we did 38,548, which on average would be about 129 tests per day. In 2021 we did 387,266 tests. That on average would work out to be 1,061 tests per day. In this year, we already would have completed 88,791 tests, which works out to be 2,219 per day. So that's the rate at which we're testing right now, and we have increased the testing, and therefore we're trying to find as much people who are positive as possible.
All right, Minister, last year you mentioned that Guyana would likely be producing the Pfizer pill once it's approved. Is this still among the ministry's plans?
Well, I recall somebody asking me a question whether or not we would like to have those pills here in Guyana and whether we would want to manufacture them. At the time, what I said was that the government of Guyana would not be involved in the manufacturing of the tablets. But if there's a private sector entity that is interested in doing the manufacturing, then we are willing to support. So that would have to be a private arrangement between Pfizer and whichever company they choose, because Pfizer has been working with companies around the world, pharmaceutical companies around the world, to manufacture its medicine. So while we would encourage such an investment, the government per se would not be establishing a pharmaceutical company or factory to manufacture the drug. On the other hand, what we are working on currently is to make sure that we can secure both the Merck drug and the Pfizer drug. And so we have been trying to work with different companies to see if we can get that into Guyana.
Has the ministry recorded any cases of long COVID among children that have had the disease thus far?
As I said before, we have established a task force within the Georgetown Public Hospital with a number of specialists. And if there are cases of long COVID, those persons would normally be referred to that specialized clinic. While we would have had about 7,000 or so cases in children, most of these cases were mild. We did have a number of hospitalization, but I think most of those patients would have recovered. However, if there's any child that is suffering from signs or symptoms of long COVID, they can always come to the hospital where they would be examined by this multi-speciality task force that we have on COVID.
All right, Dr. Anthony, finally, can we have our vaccination numbers?
So in terms of vaccination numbers, we've had over the last 24 hours, 1,161 persons who got vaccinated. So that took up our numbers slightly. We've had 427,336 persons getting a first dose. That's about 83.3% of the adult population. And we had for second dose 319,596 persons. That's 62.3% of the adult population receiving a second dose COVID vaccine. In terms of 12 to 17, 32,978 persons, that's 45.2% of that age cohort, getting a first dose. And for second dose, it's 23,528, or 32.3% of that age cohort. Booster doses have gone up slightly. We are now at 43,715 booster doses. So again, the appeal would be to get people to be vaccinated, and hopefully we can get more people coming out to get these vaccines.
Okay, Minister, that concludes our update for today. Thank you for joining us.
Thank you very much.